Where are you speaking this morning, and what will you be talking about?
Well, I will be speaking in the National Press Club, and I will try to explain how the Dutch drugs policy works and why we think that it works very well in the Netherlands.
Why are you here to do that?
I'm visited New York first for the Commission on Social Development, and we're very strong on the volunteer resolution, preparing for the volunteer event going on in the UN in December 5th. And we made a combination with our Dutch embassy to explain here the Dutch drug policy, because I think it's important that people understand why it works and how it works. We did that a few years ago when we had a very good contact with the US Department on Health, and I think it's a fruitful cooperation, and we try to follow up on that.
What is the policy?
The basic point in Dutch drug policy is that we consider people as addicted when they hard drug users. And the second point is that we consider the consumption of soft drugs as something that can't be completely pulled out of society. So you have to accept that it's there, but you have to control the setting where it takes place so that it's not criminalized, and people who are in need of any assistance that there is any assistance available. But basic point is that it's considered not as a crime issue, but it's considered as a health issue, basically, and that you, at the same time, that you're very strong against any type of hard drugs, and you have a very strong police policy on avoiding any type of hard drugs in the country, producing either or people buying and selling. And it's this close cooperation between health policy and police policy that I think that works very well by us.
We invite you to join us. Peter Pennekemp is the Dutch Undersecretary for Health, Welfare and Sports in town to talk about the Dutch drug policy. We're going to talk in the next few minutes about how it might apply to the United States, but interested in your questions and comments about the policy, which we've heard a lot about in reporting about the drug question here, about how they do it in the Netherlands. 202 is the area code. 737-0001 is the line for Democrats. For Republicans, 737-0002. And others can call us again at 202, the area code 628-0244. And all of the phone lines are open right now if you'd like to join us with your questions about that. Are drugs legal in the Netherlands?
No, they're not legal.
So if they are illegal, then how does the government approach dealing with the problem?
The basic point is that the priorities in the police policy is first of all, of course, on hard drugs. And that's a very high priority. And it was decided at the end of the 70s that on soft drugs, that if you're using it for personal purposes, a very small amount, that it's not being prosecuted, as well as if you buy a very little amount for yourself. And that if it's sold in a very small amount, that it's not legal. But there are many things in life that are not legal, but not considered as a high priority on the police force area. And that's a very basic point. And we believe that if it's taking place in a controlled setting, you can avoid having it in the sidelines of society, that people are in contact with criminal organizations because they have to be in the criminal area. In all countries all over the world, you see that young people are trying new things. One of those things, and that takes place in Australia or Sweden or Ireland or France or the Netherlands or the US, trying is some type of soft drugs. Quite a lot of people use it once or twice, and it's a very small group that use it a little more. If they have to go to illegal areas for buying it, then they get into the illegal scenery, and we try to avoid it, and we think that is successful. At the same time, we're very strong on hard drugs, on ecstasy or heroin or crack and these things. But you have to consider the uses of that type of stuff, that they are addicted. And we consider them as being treated for their addiction. And we feel very pleased that most of them are in contact with their GP, so their health situation is controlled in some way, instead of having them marginalized in society with a high percentage of death. And you have all these HIV problems related to it, and we have it in a type of controlled setting.
Describe, and we'll take a call after this. Describe how a drug user, on a typical user on a day, gets the drug that they're after, where they go to get it, who they buy it from, in the process of doing that.
Well, if you're talking about hard drugs, when they buy it, it's like everywhere, somewhere in illegal sceneries. And we're very strong against that. And we're trying to find them and try to, especially to go after the dealers. That's one. If you go on soft drugs, people can buy soft drugs if it's in that local community accepted that there is what's called a coffee shop. It's because it's priority for the local authorities to take the decision whether they want the coffee shop in the local community or not. If they buy it, they can buy 5 grams a person there. You can walk in. You have to be over 18. The coffee shop have to be in a controlled setting. There's no other type of illegal drug. If it's ever found an illegal drug there, it has to be closed down immediately. There is no alcohol there, and people are permitted to buy this very little amount and to take it home to use it. What we found out is that a very small group is a regular user, and that there is a large group who tries it once or twice in lifetime. And if they take it, they take it for a weekend at home. You have this small group. I think in our country, we're talking of tens of thousands who use it sometimes. And of course, you have this very specific group that worldwide is going on a lot of research. People with MS who think that it works very well for their health situation. And we're doing research together with many other countries on trying to find out whether it can be used additional for them or not. But that's a very specific situation. I won't consider that further. I mean, I know that in many countries this type of discussion is going on. But what we call recreational use goes on in a controlled setting.
In the Netherlands, the Undersecretary for Health, Welfare and Sports is Peter Pennekemp, with us for about another 30 minutes or so. Mount Vernon, Illinois, on our line for Republicans. Good morning.
Yes, sir. I'd like to commend the Dutch government and the gentleman that you have with you for his approach. I spent 32 years in law enforcement, a period of time, 7 years in Southern California, 12 years in Las Vegas, Nevada, and 12 years in South Central Illinois. Our war on drugs here is 70 years old. Back in 1931, when Henry J. Ansinger and his cronies needed some people for jobs because Prohibition had been repealed, created the Marijuana Tax Act. It's been ineffective. The only deaths that I know that have come about from marijuana, for example, is maybe terminal munchies. The problem with the marijuana now is that it stops the gag reflex, so that the young people drink alcohol and they don't throw up and get sick and go on home. The DARE program is a complete failure because in the rural areas, the kids are shown how crack is smoked and how cocaine is free-based. And I'm certainly opposed to any mind-altering substance being used at all.
Illinois, let me ask, from your law enforcement experience and from what you know about what they do in the Netherlands, is any or all of what they do applicable here?
Absolutely. I think that California had a lead on that as far as the medicinal use and also other uses such as fabric for the hemp and such. I think that that's very reasonable. Glaucoma and people that are cancer patients don't throw up their chemotherapy. Thanks for the points. Peter Pennekemp.
I think what has just been mentioned is really worthwhile noticing that it's important, as has been said, that on the crack and cocaine issue, you have to split it completely from the issue of using marijuana. And we have a committee set up about the medical use of cannabis, and we have some of the patients in there, HIV patients as well as MS, and they say that it's really has a positive effect on them. And our idea is that together with other countries, we can find out in research how it works. And we found out that this policy that we have now for about 25 years works better than trying to avoid any type of soft drugs in society, because in countries where they tried it, the amount of use is at least as high as in countries who have a more tolerant policy like some other European countries and the Netherlands.
On our line for Democrats is Somerville, South Carolina. Good morning.
Good morning. Listen, I've got an opening comment, then I'd like to address the drug issue that has been brought to us by the Dutch, which I support. But Lauren Whittington had 42 alms. Okay, that's all I had to say. Then, as far as the drug policy, I agree. I think this country has a long way to go politically to accept that policy. I think it's going to be a long fought before we see it in the United States. I think you're going to have a lot of the religious groups that are going to say that you're suggesting that their kids try drugs or accept the fact that the drugs are okay. You're going to have the politicians that are going to be afraid and wane off of that because they're not going to get voted in, because these groups do support monetarily and carry a lot of voting power.
Mr. Pennekemp.
I think the point that was just mentioned, the idea that drugs is okay is not our policy. Our policy is that we try to bring over information to young people that it's not okay. Alcohol is not okay, smoking is not okay, and drugs is not okay either. And we bring in very good information to high schools and to young people and areas where young people are. But at the same time, if you notice that young people are using it, you can ignore it, close your eyes, and say, let them go to the illegal sceneries, and you know that they got in contact with all type of different groups. Or you can use some type of controlled setting, and that's why we have the age of 18 being the age that you can buy some marijuana in a coffee shop instead of having it buying on the street. I know that in all countries in the world, when you go into a certain area and ask somewhere, you can buy the stuff. While in the Netherlands, you don't need to go to in the specific areas. You can go, if in that local community it's accepted, you can buy it in a coffee shop in a controlled setting.
You mentioned earlier about this relationship between the health issue and the police issue.
Yes.
In a situation where a seller and a user have made a bargain and someone has bought heroin from the seller and the police come to that situation, what happens to each of those people, the person who sold it but the person who's the addict?
The person who sold it is being prosecuted, definitely, and we try to find out the line, how he got it. And they're going after it very strong. And he's followed up very heavily, and he's sentenced in a way. The addict, especially in the case of heroin users, the amount of new addicts in heroin is limited in the Netherlands. Most people who are addicted already a long period. Most of them are known by the health authorities in the local community. They're provided with methadone. And they're treated, and they have access to needle exchange programs, and they have access to medical care. And we're trying now to, in close cooperation with other countries too, and in a controlled setting by the INCB in Vienna, the UN agency, what we call heroin on prescription. You might know that in Britain already heroin on prescription is already for a longer period for a very limited group. In the Netherlands, we noticed that people who are addicted for a long period, if it can take place in the controlled setting and so on, that their health situation can improve. We try to find it out, and the results will be there March next year. The addicted person is looked after, first of all, from a health situation, and we try to give him assistance that he can live in a normal situation, as far as it's possible, of course.
Peter Pennekemp is the Dutch Undersecretary for Health, Welfare and Sports, with us a little less than a half hour in town, speaking at the National Press Club later today on the Dutch drug policy. On the Democrats' line is Arlington, Virginia. Good morning.
Good morning. I want to thank the Dutch for standing up to the international hysteria and the separation of marijuana from hard drugs. In America, the big lie about marijuana makes young people ignore warnings against other things. So you have them huffing glue, solvents, and dying. I think that the media needs to explain to the population the amount of money that is being spent on, just if they would separate marijuana from the other drugs and save all the money that they spend on prosecuting users of marijuana and all the money they spend on destroying their lives and putting them in jail, and instead spent that money going after hard drugs and being honest with the people and saying marijuana is less harmful than alcohol or tobacco. It's not good to do any drug, perhaps, but young people are going to experiment. They want to know what their minds can bring them. Marijuana helps them think more deeply.
Mr. Pennekemp.
Well, I think that the remark just made it very clear that you have to consider it as some type of material that is not good for you. I mean, whether it's tobacco or alcohol and things like that, other things are worse. And if you can make it very clear to young people that, of course, marijuana is not good, but if you use it, do it in the controlled setting. And make very clear that any type of hard drug is terrible, is far worse. Then you can make it very clear to young people that if they want to experiment a little, I mean, I don't say that we encourage it, not the opposite. We disencourage. I mean, if you see the material we use at high schools, that's very clear. As the material on tobacco and alcohol. But it's important to bring over to them that if they ever want to experiment in life, stick to alcohol and marijuana. And if you want to try a little part of a cigarette, stick to that, and that's life. But stay away from all type of hard drugs in any way.
Goldsboro, North Carolina is calling on the Republican line. Good morning.
Yes, good morning, Lou. Thing I got to say is I'm a retired naval officer, and when we went to Holland and in Amsterdam, you see all these young kids, not only young kids, but older people, spaced out underneath these bridges, shooting up with whatever they were shooting up. You go to the bars, and they got hashish. You can buy it right over the counter, and you know, it's just people are all spaced out. It just doesn't work, you know. I mean, these young kids coming up to girls trying to sell themselves to the sailors and that, and it's really bad situation over there. When I was over there,
when was that?
This was about 1990.
Thanks for the call. Changes since 1990?
Well, I think that, yes, we had some changes since 1990. We gave more authority to the local community on closing down coffee shops. That the amount of coffee shops can be limited, that they have to be in specific areas, not to be in specific areas, to be more clear, not near schools and things like that. At the same time, looking at data, and they're not from the Dutch government, but from an EU agency, we see that the amount of soft drug users in the Netherlands is just the average in the EU, and it doesn't. The interesting thing is that if you are looking at countries like Belgium and some parts of Germany, there is similar data like the Netherlands, and if you look at countries like Sweden and Ireland, who have a strong non-drug policy, that they have about the same amount of soft drug users. What the man just talking from North Carolina has been seeing, I know it's terrible to see, because I know the streets where he's talking about. But he must have noticed, too, that it was safe to walk there, and that it's in a controlled setting. And that's comparable to some other cities in the world where you don't feel safe on the street. I think that's a little different. And that's why we say you have to look at it from the health perspective, and at the same time be very clear on your police policy.
Your jurisdiction, you are Undersecretary for Health, Welfare, and Sports.
Yeah.
How did those three items become under one Undersecretary?
Well, it's the responsibility for my ministry. I'm together with two other colleagues who are also Undersecretary in the same ministry, and in my portfolio there are several issues like the volunteer issue, the welfare issue, mental health, youth policy, and sports, and that's a wonderful combination. So I have three elements of all, like the issue of hospitals is under activity of one of my other colleagues, as well as all types of long-term care, who has been in my portfolio, but my portfolio extended and extended, so we changed it.
Peter Pennekemp, I'm sorry?
It's a nice combination.
Peter Pennekemp is the Dutch Undersecretary for Health, Welfare, and Sports in town, talking about the Dutch drug policy. With us about another 20 minutes. Honolulu, good morning.
Good morning. I visited Holland in 1994, and I saw nothing like what the previous caller was talking about. I saw a very controlled, very wise, very wonderful policy that America should adopt if only they weren't so afraid of taking the lead from another country. Our arrogance keeps us in the dark about these things. These coffee shops, the only people I saw spaced out were American tourists who were dying to get in there to try it. And by the third day, it becomes passé. The people that live there don't lie around stoned and unproductive as we're so afraid might happen. It just becomes part of the scenery, and people aren't flocking there to get high every day. If you have a job, you have a job you have to do, and it's ridiculous. Americans have demonized, and I'm not a marijuana smoker, and I think alcohol causes a lot more problems than any of this marijuana ever did, and it makes so much sense to pull it out from the back streets and put it in and tax it and keep a control on it, and you eliminate so much of the black market, so much of the criminal element, so much of the riffraff that goes along with it. It just makes so much sense, along with their laws on racial tolerance and live and let live in many other areas.
Thanks for the points.
I think that the way he mentioned the Dutch policy is a very well prescription. I think it's worthwhile noticing that it's really part of the recreation scenery, and we just even made a new legislation on the type of soft drug using and car driving. It was noticed that some people, all countries have legislation that you're not permitted to drive a car when you have been drinking. Well, the legislation was not completely clear on any type of medicine use and any type of addiction. So we added some legislation even on that it's not permitted to drive a car in that type of situation. And it's good that people are aware of the risks that are there, and I would recommend anyone, if you ever smoke marijuana, to drive the car afterwards. I mean, I wouldn't recommend it at all. I wouldn't recommend it driving a car after having been drinking alcohol. It's just like that.
He also mentioned that this idea that you hear sometime in this argument about if we tax it, the government can make money off of it. Does the government in the Netherlands make money from this process, or does it cost you money?
I think it costs money because we're going very strongly after the addicted persons in hard drugs. We don't make profit out of it in the soft drug area. I mean, that's a market issue, and well, there have been discussions like everywhere in the world on nationalizing the production. Well, as I said before, I mean, it's a market issue. We don't go on that, so it's not a profit-making issue. But we decided that if marijuana can be used as a medicine, it will probably be on the government control setting.
Who runs the coffee houses?
The coffee houses are run just by private persons who can. Some people starting a coffee shop like another one can open a restaurant, but you need to have police permits and fire permits and all these type of legislation, and that's all in a controlled setting by the local authorities.
As a business, do the folks who run the coffee houses make money?
Yes, if they make money, then they pay income tax on that, just like everywhere.
Our next call, excuse me, is from Alton, New Hampshire. Good morning.
Yes, good morning. Appreciate C-SPAN bringing up this important issue. One of the frauds that has been perpetrated that American people don't realize is that America really is a drug-based society. Alcohol, as the previous caller pointed out, is a drug and is a very popular drug. The biggest advertiser at the Super Bowl this year and the most popular ads were made by Anheuser-Busch. NASCAR racing, which is the biggest spectator sport in America right now, originally started by Prohibition rum runners down in the South. Republican Governor Gary Johnson in New Mexico has come to the forefront in saying that we should have decriminalization of drugs and that, in fact, most people use drugs responsibly. And even the liquor companies now in their advertising advocate using their what they don't call drug responsibly, and that really is the message. Education, responsible use. In Kentucky and California and numerous states, marijuana is the #1 crop. The government isn't making any money on it. It's not going away, and something has to be done about it, to say nothing of the tens of thousands of productive people wasting away in jails, ruining their families, and using a lot of government money that could be put to much better use. Thank you very much.
I think that the point just mentioned from the man from New Hampshire is an interesting point on the advertisement on alcohol and tobacco. It might be interesting for you to know that the European Union just accepted some guidance to limit the advertisement on smoking on all type of sports events and all types of activity to disencourage people to use any type of tobacco. And I think that's a very important point, that you are aware of the role of advertisement. And we have also the idea that people who are using soft drugs are aware what they're doing. And if you consider hard drugs users as addict people, you can better treat them and give them assistance in daily life. And we very positive about the effects on the HIV spread out in our country, because the addict people are in a controlled setting and they're able to have their lives controlled.
That last call on our line for Democrats. Next call on the line for Republicans. Jacksonville, North Carolina.
Oh, yes, sir. I have a few points I would like to make that I believe for the United States would be important. And my first point is marijuana is a gateway drug. I've seen it myself when I used to live in one of the 5th largest cities, Philadelphia, Pennsylvania. My next point is the United States is a superpower and a world power. The more our people in the United States become weak-minded junkies, everything is going to decline. And my next point is the drug war in the United States is incompetently mismanaged and incompetently fought with not enough resources. The government is not thinking properly on this plan on how to fight the drug war. And my next point is the Netherlands is not a world power, superpower. The Germans in World War II knocked them off in a couple days because, if them people want to use drugs and be junkies and liberalize their drug policies, that's fine for them. I have nothing against the people of the Netherlands, the Dutch people, but having any kind of drug use being liberalized or the policies being watered down, that's how you got a third world country when you do that, because drug usage is for weak-minded people.
Thanks, North Carolina.
Well, I have two comments on that. The point that soft drugs are a gateway, there is no evidence on that at all. I mean, the marijuana users are normally don't. There is no specific evidence that using marijuana will be a gateway. There is no scientific evidence on that. The only evidence that is very slow on data, very low on data, is that there is a relationship with using tobacco. And I wouldn't say that tobacco is a gateway to all these things. We have the idea that it's split groups. The second point, that the Netherlands is a weak country. It's interesting to notice that in the European Union more and more countries are interested in this type of policy, because it gives you the opportunity to go very strong after hard drugs and spend all your police force activities on that, because hard drugs harm people. harm societies. If you use soft drugs in a controlled setting, you don't have this situation. And I wouldn't consider the European Union as a soft area, as you see on the financial markets and things like that. I won't go in detail on that, but I don't think that that has to be related. And what the U.S. did for Europe in the Second World War was wonderful.
Diebold, Texas. Good morning.
Yes, as the man said, there's no evidence that marijuana is a gateway drug. And as a matter of fact, it's been medically proven that it's less harmful than tobacco or alcohol. So why can't we just regulate marijuana with the same laws we have for alcohol? It's just ridiculous to incarcerate people and ruin their lives, and for something that's less harmful than alcohol.
From what you've heard of the discussion and what you know about how the Dutch handle this, do you think it's applicable here?
Well, the thing is, if a person wants to smoke marijuana in this country, he has to deal with the criminal element. And just setting up coffee shops I don't think would work, but if you sold it just like alcohol and regulated it as far as driving and being drunk in public, that would work.
I want to repeat once again that it's that according to the international agreements, there's no misunderstanding that marijuana is an illegal drug. But as has been said by the person from Texas, we do it in a controlled setting, and coffee shops need a permit to be open. So people are not just free on the streets to sell any type of this material. It's in a controlled setting, so that there is good contact with the police. And as I said before, once they're in a coffee shop, there's find any illegal material or it's sold to persons who are not permitted to buy it because they're underage, the coffee shop will have to be closed down immediately. There is no way out. And that's a change that took place about 5-6 years ago.
Is what you do there unique, or are there any other countries that have similar programs?
We noticed that more and more countries in Europe are step by step changing their policy in more Dutch way-oriented approach. They don't have the coffee shops, but some countries change their legislation, not prosecuting any longer the addicts, whether they're hard drugs or soft drugs users, and not go after users, but they're closely cooperating with the Netherlands, for instance, like a country like France. We have a good cooperation with France on the police side, and that we have a good cooperation in looking after substitutes for hard drugs, on whether it's methadone or another material, and they don't prosecute the soft drug users in the way that they did before. And that's an interesting development that takes place in Switzerland, in Germany, in Belgium. Not all of Germany, but several parts.
Muskegon, Michigan. Good morning. Michigan? One more time for Michigan. Try Colorado Springs. Good morning.
Good morning. I'm calling in regard to the subject that you have on today. I've had a lot of experience with this over the years. I'm a woman doctor who used to practice in Harlem years ago. And the use of drugs during the time I was there in the 50s was rampant because no one paid any attention to what was happening in that part of town. And I had been to parties during that time in which cocaine was used, and I thought it was harmless, and heroin, marijuana, and so forth. But anyway, subsequent to that time, I also have been involved in the treatment of people who have been addicted to drugs as well as alcohol. And I'm not going to talk about alcohol because I know that that's a bad drug. And right after I came back from Vietnam in 1971, where I had been involved in the treatment of soldiers over there or other military who were really strung out on, about 70% of them were using heroin. And that was probably because when they came there to Vietnam, they were using marijuana, and we ignored it. And the next thing we knew, we were in trouble about heroin, which was pure at the time and didn't need to be shot up. It was all smoked. And finally, I felt that the reason we began to see, quote, these light at the end of the tunnel and come home was that by January of 1971, we were sending home about 6,000 troops a month on medical evacuation who were hung up on drugs. I mean, on heroin, to be exact.
Thanks for all your points, Mr. Pennekemp.
Well, the point just mentioned about heroin, I completely agree with. I mean, people are, once they get addicted to heroin, they ruin their lives. And you have to make very clear that people never use that type of material. What we try to avoid is that people who are in contact with some type of soft drug as part of the recreation scenery or any other setting, that they don't have any situation to get in contact or to step over to any type of hard drug, and it's very clear. And the issue of there is not so much scientific material about very long-term marijuana uses restricted to marijuana. Most people who are addicted for a longer period are people who use several types of drugs, hard and soft drugs together, and that's terrible. You should avoid it anyway.
Cape Cod, Massachusetts. Good morning.
Hi there. Good morning to you, Mr. Secretary. You're very cordial and polite. I'm a little bit affronted by your designation as a Minister of Sport and Drugs. I think the two are sort of mutually exclusive, at least I believe that'd be an American view of things. I wanted to speak to you just briefly about the idea of heroin on prescription. You mentioned that. You mentioned also sticking to alcohol and marijuana rather than shudder, some sort of hard drug. Of course, the active component in marijuana is being ginned up all the time. I guess it's THC or whatever it is, so you're going to find some more and more powerful stuff there. But for your pious talk about how, well, we have all these signs posted there, and we take it so seriously that our children are not, given bad information, led down the wrong path. Isn't that pretty much like saying that you're against speeding? And don't you actually have to have some enforcement? You have to believe that speeding can be dangerous.
The point is that the basic idea of Dutch health policy is that people who using material that is has some negative elements in your brains or temporary or long term, whether it's medicine, whether it's alcohol, whether it's marijuana, you should inform them that there are some risks related to it, because you can be in a setting where it harms your physical situation temporarily, and we provide them with that type of information. In our ministry, we think that of course sports and drugs don't go together. It's just a combination in the ministry that health, welfare, and sports are together in the ministry, and of course I don't link up drug policy with sports policy. I mean, there's no doubt about that there is no link between. On the issue on prescription of marijuana on prescription, we're looking at it, and there have been a little bit more experience on heroin on prescription in very controlled settings, and we're doing research on that, and together with our Swiss colleagues and the colleagues from other countries. And we're looking at it, and I don't take any conclusion now. On the point of the powerful THC and development of that is something that had been asked before and by our parliament also, and it's a very interesting issue too. As far as our material shows up, the percentage of THC can differ, of course, but the average material that's sold in the coffee shop didn't really go up as some people think. I know that there are some in controlled medical use sceneries, there are some discussions about having higher percentage of THC. We're not that far yet, but the regular sellout in the coffee shop is just as it has been before.
Are the coffee shops open only to citizens?
No, the coffee shops are open to everyone who wants to walk in, as long as they're over 18. They know if you are clearly someone who is on abuse of alcohol because you're drunk or some way or like that, you're not permitted to buy anything, and you're not to that. It's not to our way of thinking that you should limit shops for only citizens. I would consider that as not comparable to the legal situation in our country, as in most countries. I mean, I'm free to enter any U.S. shops either.
Just a few more minutes as we talk about Dutch drug policy. Fredericksburg, Virginia, good morning.
Good morning. How you doing?
Good, sir.
Look, I want to make a comment about the marijuana not being a gateway drug. I think that's ridiculous. If you look at, continue your analogy to alcohol, an alcoholic doesn't become an alcoholic by hitting hard liquor right off the bat. He starts off, from what I've read about it, he starts off with beer, gets his body builds up tolerances to it. He needs some more beer for a high. He gets to where he needs harder liquor, higher proof, higher percentage proof, 180 proof. I mean, it's a progression on down the road. Same thing with smoking. A guy doesn't start out smoking 3 packs a day. You smoke a couple of cigarettes a day, then your body craves more, and so you have to have more and more and more. And I think it's ridiculous to say that that marijuana does not do that. You go ask any hard drug user. From what I've seen on research, they don't start out with heroin. They start out with something small, and it builds up.
Mr. Secretary.
As I mentioned before, there is no scientific evidence that because you're using marijuana, you step over to hard drugs. You can look at it also from a different perspective. If you are a hard drug user, you probably went for some material. And you see that most hard drug users have been using a lot of alcohol before, have been smoking, and have been using marijuana. But that doesn't mean that marijuana is a stepping stone in this whole process. There's no evidence for that. As you see, the percentage of people using marijuana in lifetime or the last months, and you don't see any evidence that there is a relationship with using hard drug as a stepping stone in that process.
State College, Pennsylvania, good morning.
Yes, good morning. I would like to say that I'm a middle-aged woman who went to Amsterdam as a cultural tourist to see the museums of Van Gogh and the Dutch masters. And I have to say I was incredibly impressed with the peace and the quiet of Amsterdam. I didn't see any evidence of drug use at all. I walked through the streets, I took the public metro, I took the train, I felt very safe. And I would just commend the Dutch government on their efforts to live in a straightforward and realistic approach.
From what you've heard in our discussion this morning and elsewhere where you've learned about it, do you think what they do there is applicable here?
Oh, absolutely, and I really like the idea of separating marijuana from the harder drugs. It's an unprocessed product of the earth, and I find that would be a realistic approach.
Mr. Secretary.
Well, I'm pleased to hear that she enjoyed the stay in Amsterdam, and well, it's a wonderful city with a cultural event and a very interesting culture.
And your hometown?
I'm native.
Peter Pennekemp is the Dutch Undersecretary for Health, Welfare and Sports, speaking in Washington later this morning at the Press Club on the Dutch drug policy. Thanks for some time for us.
Thanks for being able to explain.
In about a half hour, at 1/4 the hour, the acting director of the Peace Corps will be here to help us talk about the 40th anniversary of the Peace Corps. But before that, Joel Gora of the American Civil Liberties Union and Susan Musquette of the Christian Coalition will be here to talk about a news conference later this morning on the First Amendment and campaign finance. We'll be right back.